Good morning, everyone. This is Ann Wynn. I'm your Regional Implementation Specialist for the Southeast area of Wisconsin. Thank you so much for being on the call today. We're really excited about this project. It's the first time that we're doing an innovative project that allows us to partner with a prescriber who could refer into the program. And you guys are the first round, and we're excited for the potential that this could lead to. So a couple of quick announcements before we get started. As you may already be aware, we are live with Aprexis and we are live with pushes in the system. So please log into your queue as you will see pushes for Medicaid patients and work through your queue. There is technically no deadline for these pushes. However, we want to be able to show that our pharmacists are acting in a timely manner to these pushes. So we set a deadline or a goal of a Groundhog's Day or February 2nd, 2015. If while you're working through them, something doesn't apply to your patient or the patient initially declined the appointment, go ahead and close it out, because what will happen is it'll get sent to you again in 3 months. Or if a month later they decide they want to come in, you can always pull that intervention back into your queue. So just manage your queue and keep it clean as much as possible. And the data is refreshed every month, so you will be getting pushes on a regular basis. So it's important to maintain and keep a clean queue. In addition, to help with getting pushes completed, getting people excited about it, we have the sticker challenge. So please continue to participate in the sticker challenge. Interventions that are billable and that count for the grant can be, once you provide the intervention and enter into Aprexis, you can give yourself a sticker, and it's a statewide challenge, and there's money set aside to help reward pharmacies that are really getting engaged and having a good time and also making an impact on the patients of the state. Additionally, we've had a round of trainings that were live all across the state, but we continue to provide trainings. We just had webinar trainings that are available now on the Aprexis training website, or Aprexis website under the training tab. So when you log in, each module, each topic of the live training was broken up into a module and recorded for your reference. So if your staff member or yourself needs some brushing up on, you can review the training on that tab. And we have also planned some live trainings. Right now we had a December 2nd in the PSW office that's already full, but we opened up January 8th and 27th at the PSW office. And we're also exploring opening up another live training in the Milwaukee area. So if you have a preference for day of the week and time, we love that feedback, so we can schedule something that could fit your schedule or your team's schedule. And finally, the newsletter, the WPQC newsletter, is the best way for us to communicate any frequently asked questions for billing, resources through the program, or any updates, and that only week. So if you're not receiving the newsletter, please email Erica Horstman, E-R-I-K-A-H, at pswi.org, so that we can get you on the list to receive the newsletter. So with that, that concludes our announcements. I'll just dive into the presentation. So the impetus for this started about a year ago. Erica sits on the Wisconsin Asthma Coalition, and as part of that coalition, there's a physician named Matt Gray who works at the Children's Hospital, and they've connected and talked about the WPQC program and its goals. And we brought up the idea, or Erica brought up the idea of partnering so that the children who are admitted in the Children's Hospital could be seen in a WPQC pharmacy, and they loved the idea, which is kind of what started this project. So as a background, the Children's Hospital of Wisconsin is a tertiary academic referral center, and they're a level 1 trauma center. They have about 60,000 visits annually, and of those, about 2,000 to 2,500 of those are asthma, and those patients are able to be sent home. The goal of this project is to, of course, expand the WPQC program and get referrals into the program, but also to help meet our grant metrics, specifically to decrease asthma exacerbations, decrease asthma-related emergency department visits, improve patient understanding of asthma, and really improve their adherence to their control or medications. What we heard from that was that, when these kids are admitted, a lot of the times they don't understand what each of their inhalers is used for and how to use the inhalers properly. So if we could really help them understand that and utilize their inhalers better, we could improve and decrease exacerbations. And as well as, optimizing device technique, which falls in line with what we do with WPQC already. So the workflow on the Children's Hospital end, how that would look like is once the patient has been seen and treated and released from the emergency department, the outreach nurse will contact the family or the patient's guardian within 24 hours of the visit. They'll offer WPQC service, and if the pharmacy agrees to the service, a referral fax is sent to the WPQC pharmacy.
If the patient agrees.
Sorry, if the patient or the family agrees to the service. So here you'll see a diagram of the workflow. It breaks it down into the emergency department, what the nurse will do, and then what to do on the receiving pharmacy end. So first, again, as I mentioned, at the ED visit level, the patient is seen, the patient is treated, prescriptions are provided as needed, and the medication list is reconciled, and then the patient is discharged to the home. Then the outreach nurse, this is their process currently, will call the family within 24 hours via a report that's run. And that report will identify patients who are in a certain target zip codes. And we had identified these zip codes as zip codes where the majority of their patients come from. And they will use that along with a list of the patient's insurance information to generate which patients are potentially eligible for WPQC services. They'll attempt to call every single patient and offer them the service. And typically they now offer the FAM Allies, which allows a visiting nurse to go to the home and assess for asthma triggers and to minimize asthma triggers in the home. And then in addition to that, they will now offer the WPQC service. So if the family chooses to participate in the WPQC program, then the nurse will send a fax to the zip code, to the pharmacy that falls in the zip code where the patient lives. Or if the patient has a preference for a pharmacy that's outside of their zip code, that pharmacy would receive that fax referral as well. On the receiving pharmacy end, the pharmacy will receive the fax from the Children's Hospital and will contact the family. Our goal is that the pharmacy will contact the family within 72 hours of receiving the fax to schedule the appointment. And again, these patients and these families have already agreed to being seen. And then our goal is that the patient is seen within 14 days of the referral. Know what the script looks like when the nurse is calling the family. The nurse will call and introduce herself and ask to speak to the guardian and review what they typically review after the emergency department visit. They will offer either the FAM Allies program or the WPQC program. And then if the family chooses the WPQC program, they'll go into some key points about the medication checkup, the goal being to improve their adherence to their medications, improve control of their condition, to meet with the pharmacist to review their medications, that it's covered by their insurance, and that they don't need to get their medications at this WPQC pharmacy in order to get the service provided to them. The pharmacy will provide the service, or the fax will be sent to the pharmacy, and then the family will be notified that the pharmacy will call them to set up an appointment. And then if the patient has questions, we've the nurse questions or concerns that patients can respond to when offering a medication checkup. So, what is a medication checkup? Doesn't my doctor already provide this? I thought pharmacists already do this. My caregiver takes care of this already. I don't want to discuss this with my pharmacist. I'm embarrassed because, my condition is not well controlled, or I just don't have time. So these are common objections or questions that patients might have, so they're equipped on how to handle those questions as well. Then the fax is sent to the pharmacy, and the fax template, just so you can see what it looks like, so you can be on the lookout for it. It'll have the Children's Hospital logo on the front, and then some information about the program, and the contact information for the outreach nurse is located on the bottom of the fax as well. And then the second page lists all the information you would need to call the DAPO Center for an approval. So the patient's name, the reason for the referral, and then the nurse will select with the patient or the patient's family which pharmacy they would like to receive the referral. And on the bottom, Erica will go over this in a little bit more detail. On the bottom is the hours that the outreach nurse is available to be reached. And then the nurse will write her initials, as well as the pharmacy will assign a patient code, and Erica will go into this. This will help us to track how many referrals are coming in and how many referrals are completed.
So when we send you this form after this webinar, we'd really like you all to review your information here to make sure that we don't have any typos, that everything looks good to you. And if you have improvements on how to make this easier for the process, please send them our way, because we want to make this as easy as possible for you.
So I've reviewed all that information. So Erica will now cover what...
I guess some of the, sorry to interrupt you, and information, because I read some couple of fax numbers I think need to be just corrected. Oh,
sure, yep.
Okay, sorry. Yeah, just a final review to make sure that everything looks, everything is okay.
Correct. That all your contact information is correct, so that you receive the fax and they're able to contact you if they have questions.
Yeah, and we're going to send that out this morning sometime, hopefully before noon. So if you could take a look at that and get back to us, that'd be wonderful.
Okay, that's great.
Okay.
So the final piece is the nurse will track some data on their end, and they're basically just going to keep counts of the number of families that they offered the service to, the number of families who said they were interested in the service, and the number of faxes that were sent to which pharmacies. And we will evaluate this information on a monthly basis to review the process, improve the process, and to see how we can expand. So now Erica will take it from here and talk about the pharmacy workflow after receiving the fax.
Good morning, everybody. Through what happens at the emergency department and their processes, now let's take a look at what we have outlined for the pharmacy workflow. The first thing is that you would receive that fax from the emergency department, and you're going to assign a patient code to that fax. Remember, at the bottom in the footer there was a spot for patient code. We'll show you very shortly how to assign that patient code, but that's how we're going to track these referrals that are coming in. And obviously we need you to reach out to that patient and family to schedule that CMRA when you receive that fax. We also need you to call the DAPO Center. So remember, these are Wisconsin Medicaid patients or forward health patients who do likely qualify for the service. You will use a prescriber referral or a physician referral as the reason for the CMRA. So when the DAPO Center representative asks you why they qualify, you're going to say it's a prescriber referral, and you'll have the name of the physician from that fax form. And Dr. Gray has kindly this list of NPI numbers. So these are the attending physicians or fellow physicians who are at the emergency department. So these are the common names that you'll be seeing on that fax form. Their medical director is in full support of this program, which is great, which will hopefully boost the number of referrals that, or attempts at a referral that we're seeing. So we're going to email this document out to you after our training today so that you have this list of common providers and NPI numbers reference. And this should make your DAPO Center calls a little bit easier. And then, on the first of the month, we're going to review the data from you. So I will send out a calendar invite to all of you who are like the contacts for your pharmacy, just sending a reminder to send me your data tracking spreadsheet around the first of the month. And that's how we're going to compare information between what the pharmacies are seeing, what the nurses are seeing, to hopefully help improve this program and make it more robust and sustainable. So let's take a look at this Excel. This is what we do. Anne did confirm that you all have access to Excel. If for some reason something's changed with that and you don't have access to Excel, please let us know. But let's start with column A. This is that patient code. This is where you're going to assign the fax number that you received a code. Each of you has a designated abbreviation for each of your pharmacies. So for example, this one is Aurora St. Luke's Medical Center, and we just put 001. So if you want to put Aurora St. Luke's Medical Center 1, 2, 3, etc., it's just a way for us to track each referral without having any protected health information involved. We also want you to record the date that you received the fax from the emergency department, the day that you contacted the patient or the family. Did the family agree to the CMRA, yes or no? And we've tried to make it easy for you where you can just pick from a drop-down on a lot of these columns so that our data is standardized. When we go to filter, we can combine everybody's data and run a query on it. What was the date that the CMRA was scheduled for, the time, the location of the CMRA? Was it at the patient's home? Some of you can travel to the patient's home, others can't. We understand that. Or was it at your pharmacy? What is the patient's home pharmacy? So Anne mentioned earlier that you're probably going to be getting referrals for patients who do not fill their prescriptions at your pharmacy, and that's okay. But in order for you to do a CMRA, you will need to have a copy of the patient's medication list. Part of what's going to be sent along with the fax to you is the discharge summary from the emergency department. So in combination with the discharge summary, it's important that you're reviewing that patient's current medication list. And so you'll need to ask the patient who their home pharmacy is so you can obtain that information. Also, what zip code does the patient live in? The Children's Hospital Emergency Department is particularly interested in these zip codes that we've included in, and we have if the patient for some reason doesn't live in one of those zip codes, or maybe they've recently moved. We also have a spot here for you to record the patient's primary care provider and clinic so you know who to follow up with after your CMRA. A spot for any notes. So for example, both of the patient's parents will be present. We requested permission to access their medication list from example pharmacy. Permission was received. Whatever you want to put in this column, it's really for you to help track these patients and make it easier. Did you receive DAPU approval, yes or no? Did you have a reminder phone call or some other way to remind the patient of the visit? And you can choose from the list here. Did the patient actually show up for the visit? And if they didn't show up, did they give you a reason that they didn't show up? This is something we're particularly interested in. We do know from conversations with Dr. Gray and his outreach nurses that the uptake on referral Asthma Milwaukee has been pretty low, and we know from Fight Asthma Milwaukee that their no-show rate is tremendously high. So we want to look at what are the reasons patients are for a no-show and how can we improve upon that, because we really don't want to be wasting your time. We want you to be able to get a referral, book a patient, and actually see that patient so you can get paid for that service. If we don't capture the no-show reason here, you can select other, and then you can specify the other reason in column P. And then we're particularly interested in, is that patient going to come back for another appointment with you? So have you established some rapport with the patient or the family where they do want to come back and continue that conversation and have an asthma-specific comprehensive medication review at some point in the future? So those are the columns on the spreadsheet. We'll come back to this at the end in case you have questions. But I do want to remind you that please do not put any protected health information in the Excel stripped out before you send it to me on the 1st of the month. Examples of protected health information include patient's initials, date of birth, their full name, their insurance ID number, anything that could connect the patient to the service. And that also includes like date of service. So we can't have a date of service on there for PHI reasons. Let's see. You can also add your own columns if you need to. So if you want to write down the home pharmacy phone number or their fax number or the PCP's contact information, go ahead and insert columns. We didn't want to insert a million columns and overwhelm you. So we just really wanted to make it a streamlined process, like from the time you get the referral to the time the patient comes in, what happened. These are the codes that we were referring to earlier. So the example on our spreadsheet was a these are the codes we'd ask that you put on your patient code in the footer of that fax and of this presentation, so you'll know what your code is. And I think it's important, especially for Hyatt, you guys have multiple locations involved, and Aurora, to make sure that you're picking the correct code, because this will help us track the data. A couple of important reminders. You still need to call the DAPO center. So even though it's a physician referral, you really need to get that prior authorization before you perform the service. Remember, the DAPO center will not backdate a PA, so you need to get that PA in place before you meet with the patient. We also, the same rules for WPQC apply, where you send a summary of your visit with any recommendations to the patient's primary health care provider. And if your pharmacy doesn't dispense the medications, that's okay. What we recommend is that you send a copy of what you sent to the primary health care provider to the pharmacy that does dispense the patient's medication, so that everybody's in the loop and knows what to expect from the service. And to follow up on the suggested changes to the best of your ability, this is a little bit more difficult dispensing the patient's medication, but whatever you can do to make sure that the physician's responding to that request, that the other pharmacy is aware of the request, and maybe they can follow up, it's really going to be in the patient's best interest. So please follow up to the best of your ability. And remember, we need those follow-up visits for WPQC. They're super important, because if we only have one visit documented, we can't measure a change. We need to have more than one visit to measure a change. So when you meet with that patient for the first time, you'll likely grab a baseline ACT score, but 1 to 4 months later, we need another ACT score to see if your conversation with the patient or your optimizing of their medications made a difference. So please, whatever you can, try to get those patients back in for a follow-up visit. I just want to emphasize professional courtesy, that the patients will be, you will see some patients who do not fill their prescriptions at your pharmacy, and we need to respect that decision of the pharmacy that they chose to visit. This referral is for the only RA visit. It is not for filling the prescriptions. If the patient requests that you fill their prescriptions, by all means, you can pursue that. But unless that conversation occurs where the patient specifically asks you to fill the medications, we really need to respect the existing relationship between the patient and his or her chosen pharmacy. Official start date is next week. We're planning on December 1st. This is not the busiest season for the asthma referrals. Usually spring and fall are the busiest seasons. So we're starting at a good time, because I think we'll start to see enough numbers to get us comfortable, but not overwhelm us. So that'll help us with our processes, and you guys can be comfortable with your process at the pharmacy as well. Oftentimes, the patients you're seeing already have Medicaid, but you'll probably find when you meet with those patients that there's other family issues going on. Maybe the parents have asthma as well, and they don't have medical coverage or prescription coverage using the child's inhaler, or the sibling's been using the inhaler, or something, because there isn't adequate prescription coverage. I'm told that this is a very common occurrence. Fight Asthma Milwaukee deals with this sort of situation all the time. And the Wisconsin Asthma Coalition has created a resource for you to help you refer patients to a prescription assistance program. And so the link is in here. And on the website, this was recently updated. This is patient assistance programs for patients with asthma or COPD. So if you're meeting with the child and the child has coverage but the parents don't, this is where you can, hopefully this resource will be helpful to you to help get that parent some coverage. And there's also coupon websites listed here. Whatever we can do to make sure that those patients get their medication, I think will be in all of our best interest, because it will help with adherence, it will help with control, it will decrease those visits to the emergency department. So this is here for you. So if you have questions relating to the referral that you received or something related to the emergency department process, the outreach nurse is available. If it's WPQC related, Anne is your first contact. I will be involved to help grab that data back from you to circle back with the emergency department team. So you can always reach out to me if you have any questions regarding that. But Anne is your regional implementation specialist. She is your primary contact for anything you need, not only related to this program, but anything else regarding WPQC. If you have questions about Apraxis, if it's a non-urgent question or issue that you'd like to report, you can email them at support@apraxis.com. If it's something that's holding you up in the system or something you're just having a really difficult time with, please call them and report it right away. And then obviously the DAPO Center, you're going to need to call to get your referrals. So what questions do you all have? I don't see any questions typed in. You can all unmute yourselves. Does this make sense to you? Is there anything that you would like to see improved upon right off the bat here?
Are there any logistical questions or concerns that you might have?
I think it's pretty straightforward. It's CMRA. I think there's going to be questions when we look back at the slides, but I think it's pretty straightforward in terms of the most important thing is to make sure that the documentation of the patient information, we take those off into just the new thing is going to be the Excel sheet to make sure that we support the information that's going to help improve the program.
Did the Excel sheet make sense to everybody? Any questions about how you would enter data into it or like the purpose of it? Okay. Well, if you think of anything, you can always feel free to reach out to us. I think the big thing is your code. You're going to have some way to track the patient at your pharmacy that doesn't involve PHI so that we can receive that information back from you. So that's why we came up with the code. This is a really important first step, this project, in establishing a referral process on a grander scale. I think it's essential that all of your team members need to be aware of this project and the importance of it and be on the lookout for these faxes, because we can't drop the ball on this. Matt Gray is already having conversations with some inpatient prescribers or physicians who are looking to decrease their hospital admissions for asthma and wondering if we can expand it. So if we aren't getting a good, like if the faxes are coming in but the patients aren't being called, we're going to know that by comparing the data from the nurses to the pharmacy, and we're going to know that somebody's dropping the ball somewhere. And that pharmacy, or we'll have to figure out a way to adjust for that, because this is just super important to making sure that a referral process is standardized, it works for everybody, and it also helps the emergency department, plus us, because we have patients pretty much handed to us, ready to go, who really, really need our services.
In the case of a patient who, especially with winter coming, and a lot of these patients have transportation issues, is there any flexibility as far as being able to do it over the phone? I know that would be difficult and not optimal, but is it possible?
Yeah, that's a really good question. According to the Medicaid policy, it cannot be over the phone.
Okay.
We do have a transportation reason here.
Mm-hmm.
So you can select lack of transportation or weather, something like that. But yeah, the Medicaid policy really does prohibit you from doing medication. They do have a little statement in there that you can do it with a caregiver. Remember, these are pediatric asthma patients who are really high-risk patients because they've received an ED visit, at least one, in the last year. So that caregiver or guardian is more than welcome to be part of that comprehensive medication review. Okay, well, we also put together for the nurses a list of the contact people at each of the pharmacies so that they have that in case they have specific questions about your pharmacy or your CMRA process. So if you do get a call from Rena or Mary, I wouldn't be surprised. And we will send everything out very shortly, and hopefully you'll have some time to review and get back to us with any changes that you'd like to see.
Mm-hmm. And we'll also send out the recording of the webinar so that you can have able to make, as the things percolate and you have additional questions, feel free to reach out to myself or Erica before the program starts, and we'd be happy to help you.
We did just get a question from Demi. There were 2 Hyatt sites that were not listed on the fax form. Can we add additional Hyatt pharmacies? That's a really good question. Right now, this project is focused on specific zip codes that the Children's Emergency Department has identified that are areas that they need to focus on. So at this time, it's only open to specific zip codes. Mm-hmm. As we learn more about the program, we plan to grow it. Mm-hmm. It's just that right now, the pharmacies who are listed there were hand-selected because we know that you guys are the best of the best and will do an awesome job, and you are in the zip codes that we're targeting.
Yeah, initially the Children's Hospital were interested in 2 very distinct patient populations, the Hispanic population and the African American population, who were the majority of the patients that came into the emergency department, which is why those zip codes were determined, because that's where the majority of the patients came from. So proof of concept to make sure that this referral project works, and then they'd like to expand it and perhaps even make it into a research project for them to see if this could impact patient outcomes. So that's kind of the history behind the development of the program and why those zip codes were chosen. But we do have hopes that we would expand it to additional zip codes and additional pharmacies.
Great question. Okay, everybody. I don't see any other questions coming through. So have a good day, and we'll be in touch via email.
Thank you so much, everyone.